Welcome to the Benefits Executive Roundtable, hosted by Dorothy Cociu, President of Advanced Benefit Consulting. Dorothy is a nationally recognized benefits and compliance consultant and group health broker. Here, you will watch and listen to industry experts who will break down the latest trends in employee benefits, healthcare reform, state and federal legislative and regulatory activities, all designed to empower executive decisions. We are proud to bring to you all new for Season 6 video podcasts. We hope that you enjoy your new video podcast format, and please forgive any audio or video imperfections. Thank you for viewing and listening.
Welcome, everyone, to Season 6, Episode 3 of the Benefits Executive Roundtable. Before we begin this episode, I just wanted to let you know that while taping this episode, one of my guests, Anthony Murrello, unfortunately lost his internet connection a couple of times in the last 5 minutes of this episode. But because Chris Condeluci and I were in the middle of a discussion, we wanted to keep it as live and as real as possible. We went ahead and continued it. So we do apologize that Anthony was not able to be with us at the end of this podcast episode. I hope that you enjoyed this episode. We certainly enjoyed bringing it to you. Thanks, everyone. Welcome to the Benefits Executive Roundtable. I'm your host, Dorothy Cociu, President of Advanced Benefit Consulting. And I'd like to welcome my guest today, Chris Condeluci, who is the Washington Counsel for the Self-Insurance Institute of America. He's an attorney, and I've known him for many, many years now. And also Anthony Murrello, who is the SIIA Government Relations Manager. Welcome back, Chris, and welcome, Anthony. It's great to have you guys here today.
Yeah, thanks for having us.
Thanks for having us, Dorothy.
Oh, you're very much welcome. As we're recording this today, I just want to let everybody know that most of us in the self-insured space have just returned from the SIIA National Convention, which was in Phoenix, Arizona. It was a great conference, but it was very exhausting. It was very, as good conferences are. They go from morning till night, and, so there's a lot going on simultaneously. So thank you very much for doing this, especially so close to the conference. I know it's been a lot of travel and all that sort of thing. So anyway, I hope you have recovered from that and you're okay with doing this today.
Yeah, and it was great to see you there at the conference. So we appreciated your attendance, and it was good to chat with you briefly as well, especially in advance of this podcast. So good times was had by all, and I think there was a lot of substance that was discussed and a lot of transactions that were transacted. That's what SIIA is all about, trying to bring the self-insurance industry together, both from an educational perspective as well as from a coordination perspective.
Yeah, and it's been like that for many, many years. And it's amazing to me how many people show up in that city around that hotel. It's unfortunate that some of them aren't members, but it's a great conference, and it always has been. My applause to everyone that was involved in putting that together, because it's always a great, great conference. So let's move on, because we have a lot of stuff to talk about today and limited time to do that, of course. I want to first start talking about what's going on in Washington in general. The election is now only a few weeks away, and the presidential race, of course, is heating up like crazy. There's a lot going on in Congress, too, which we can address a little bit. But let's start with what everybody asks about, first and foremost, the presidential election. Let's focus on how the candidates compare related to their healthcare policies. What can we expect if Trump wins? What are the Trump and Vance policies all about?
Yeah, and it's an interesting question. And, Anthony and I are not about to profess that we know who's going to win the election. So we're not going to suggest who we think we are going to win.
Come on now, you got to have a crystal ball.
Yeah, but what Anthony and I can do is try to really look around the corner to say, regardless of who is in the White House and what political party holds the White House, we have a sense of what healthcare policies we might see. So you started with a Trump-Vance administration, should we have one. What we would expect is, first of all, something near and dear to the self-insurance industry is data, information, pricing information, health claims data. And even though the transparency regulations that were issued during the first Trump administration, the idea of increasing transparency around prices and health claims data was grounded in the Affordable Care Act. And the Obama administration, very busy trying to implement the Affordable Care Act, didn't really have an opportunity to get around to implementing the transparency provisions in the Affordable Care Act. Trump administration comes in, says, I want to work on specific healthcare items. Transparency was their priority. And through the Trump administration, we saw regulations for hospitals requiring them to disclose publicly pricing information, as well as on the payers, self-insured health plans, as well as insurance carriers. And I say all that just to say, because the first Trump administration was responsible for those regs, they feel responsible for continuing to implement and improve and expand on those rules. So we would expect that if there is a second Trump administration, i.e. a Trump-Vance administration, that price transparency, improving the existing regulations, expanding the existing regulations to either different pricing methodologies or different aspects of the healthcare sector and claims as it relates to the different reimbursement rates and items and services that are actually reimbursed, and other fees like facility fees and other fees that come out of pocket. We would also expect to see the Trump-Vance administration looking to put more teeth in and around existing law that requires owners of the provider network to share health claims data with the plan sponsors. Now, a couple quick things, and then we can move on to what could happen in a Harris-Walz administration. We do want to say that we would expect that there will be no repeal and replace exercise like we saw during the first administration. We would, however, expect that a Trump-Vance administration would seek to issue regulations, what we will call offering alternatives or different healthcare options that's relative to the Affordable Care Act. And what could those alternative or different healthcare options be? Well, association health plans is something that the Trump administration viewed as a priority. It's a Republican priority as well, something that will help small businesses aggregate together to offer a plan just like a large employer. And then the Trump administration, very bullish and pro telehealth. So we could see expansion in the ability for accessing telehealth services, as well as direct primary care related services. We could very well see some sort of policies either relating to health savings accounts and the ability to have free direct primary care access first dollar, where the HDHP policyholder is not rendered ineligible based on current rules. So we could very well see, again, telehealth, direct primary care, no repeal and replace, price transparency, health claims data. And I guess the last, we know that PBM reforms, which is something we'll talk a little bit later, that will likely be another priority of a Trump-Vance administration.
Well, thank you for that. Anthony, did you want to add on to that at all? Or?
Yeah, I was going to say, it's, me and Chris talked about it often. It's interesting because this is perhaps one of the first, if not a rare time in history where there's really been no unknown or challenger. For the most part, we kind of know what we're going to get with either administration. Trump, because he's already served, and Harris, even though she's gotten some slack for flip-flopping on some positions, we have a general idea that she's probably going to expand on a lot of Biden's policies. Like Chris said, double down on expanding the Inflation Reduction Act, Medicare, negotiated drug pricing, caps on out-of-pocket spending for prescription drugs, price controls and drug price increases. We're going to probably see a lot of expansion on the Biden administration's policies. Just one more thing I'll add. Chris, I know you spent some time talking about this, but the overturning Chevron deference case is going to impact the regulatory powers of the administration. As you guys may recall, the Supreme Court, they weakened the powers by removing the standard of deference to interpretation of a law by a federal agency, as long as they can provide a reasonable, keyword being reasonable interpretation of a law.
Okay, thank you for that. I want to come back. You talked a little bit about the Harris administration if they were to win. Chris, do you want to expand on that at all?
Yeah, no. So Anthony hit on, some of the, important points that we would expect from a Harris-Walz administration, and just kind of doubling down on Anthony's point, we would expect that a Harris-Walz administration would double down on the Inflation Reduction Act. And what do we really mean there? Anthony alluded to it briefly, which is through the Inflation Reduction Act, Medicare can now negotiate prescription drug prices that are covered under Medicare. In addition, there were inflationary caps, as we call them, really price controls put on prescription drugs covered by Medicare. And when I say inflationary caps, the increase in prescription drugs year over year under the Inflation Reduction Act, which is now law for drugs covered by Medicare, cannot increase greater than the increase in inflation in a particular year. But at the end of the day, it is reasonable to call those price controls. And then similarly, there is an out-of-pocket limitation, a cost on out-of-pocket spending for Medicare beneficiaries for prescription drugs. Now, we would expect, because this was discussed during the Inflation Reduction Act as it was going through Congress, to extend those policies to private sector health plans. And to Anthony's point as well, we kind of know a little bit about what we might expect, certainly from a Trump-Vance administration, because, again, we can mirror or pick up off of what was done in the prior administration, where we might not know as much about a Harris-Walz administration. Well, during the September 10th debate, one of the few answers to a healthcare-related question was Vice President Harris indicating interest in expanding those inflation reduction prescription drug-related policies to private sector health plans. So we would expect to see something to that extent. Now, one thing that Anthony didn't mention that I really do believe will be priority number one is extending what's called the enhanced premium subsidies for individuals purchasing an individual market plan through an ACA exchange. Now, back during the COVID stimulus packages, as I refer to them, that were enacted shortly after Biden was elected President Biden, these premium subsidies the generosity in the amount was increased. Also, the eligibility, the income threshold was eliminated such that any individual in the individual market could access a premium subsidy if they bought an individual market exchange plan. Well, like most things that Congress does is they do it on a temporary basis. These enhanced premium subsidies were extended through the Inflation Reduction Act, and they are expiring at the end of 2025. So if we were to have a Harris-Walz administration, I believe that administration will do everything they can to extend those enhanced premium subsidies. But I'll note that Congress, at the end of the day, is the one that needs to extend those premium subsidies by changing the effective dates in the law. But obviously, it will be a priority of the Harris-Walz administration.
Okay, well, thank you very much for that. And you mentioned Congress. Of course, that's very important, too, with the elections coming up. Are there key congressional positions on health policy that we should be concerned with?
I'll start here, Anthony, and then I'll throw it over to you. On the one hand, call me a skeptic and call me cynical. Unfortunately, Congress has not really been able to do much these days. So as a result, we would expect that there might not be that much that comes out of Congress over these next 2 years from a 25 to 27 timeframe. We would expect, and maybe we'll talk about this a little bit later, that we will have divided government in Congress. We could very well have a Democratic House and a Republican Senate. So where each of those respective majorities currently will flip. And when you have divided government, oftentimes you have partisanship. But the only silver lining is sometimes when you have divided government, there can be bipartisan deals that are struck. And just by way of example, not healthcare, Republicans and Democrats came together for infrastructure and infrastructure spending 2 years ago. That's just one example of where both parties came together, found bipartisan support for an important issue, funding to renovate and have different construction projects, as well as improving technology that everyone agrees with, right? That was ultimately enacted and signed into law by President Biden. We could very well see that in the context of healthcare. Well, where is some bipartisan support as it relates to healthcare? Well, price transparency is one issue that we've talked about at length that also is a bipartisan issue, even the sharing of health claims data, PBM reforms, even patent reforms, reforming the patent system so drug manufacturers can no longer abuse the system and extend the patents on a particular brand name drug, which then therefore pushes out, or at least keeps at bay, generics or biosimilars trying to enter the market to compete. So those would be some at least bipartisan health policies that we could see Congress consider. So Anthony, what say you?
Yeah, I would just say, like Chris mentioned, the biggest concern we have in Congress right now isn't so much the policy proposals, because what we've seen has actually been pretty encouraging, whether it's the Lower Cost, More Transparency Act in the House or PBM reforms in the Senate. The biggest concern is whether we're going to see any of those things get actually done. We had some optimism that we might see that in the lame duck session, but as you guys probably saw in the news, they just had released a stopgap funding bill to keep the government open till December 20th. So that negotiation on those must-pass funding bills are likely going to leak into the lame duck session, which has kind of been the theme of this Congress, where funding negotiations and just political pressures as a whole has kind of pushed these bipartisan proposals downstream. And I think we're going to keep seeing that in the lame duck session and possibly the next term, especially if, as Chris said, we're in a divided government.
Yeah, and Dorothy, if you'll indulge me, let me kind of maybe ask a question that you might have asked, but I'm going to key off of what Anthony just said. Is that, okay, we were just talking about what could be, right? Like what could be health policies from Vance, what health policies could we see from Harris-Walz, what could Congress work on should there be a flip in the majority after the election. But as Anthony mentioned, there is something that's called the lame duck session that happens after the election, but it's still within this particular Congress. So we're still going to have the makeup of Republicans in the majority in the House, Democrats in the majority in the Senate. So the question is will there be anything done in this quote unquote lame duck session that happens after the election, really the November and December timeframe? And what really has set up what we believe to be an active lame duck session this time around is what Anthony indicated. Congress continues to kick the can on these spending bills, but at some point, and this happens almost every year now, the rubber meets the road at the end of the year. And when you have these spending bills that must be done by the end of the year, that then opens up opportunities for other policy to be included in what we call a Christmas tree bill. Now, the Christmas tree bill can obviously, as it sounds, include multiple stuff from, again, infrastructure to artificial intelligence to, some non-healthcare related policy. But from a healthcare perspective, obviously we want to focus on that. What could we see in the lame duck? And again, Anthony alluded to this. There was a bill passed by the House of Representatives in December of last year called the Lower Cost, More Transparency Act, which would codify the hospital regulation that I discussed earlier that came through the Trump administration, as well as the payer price transparency reg. And there will be some improvements in there, some increases in penalties for noncompliance. There will also be PBM reforms in that package, requiring PBMs to disclose more information, their pricing practices. There will be provisions addressing spread pricing, whether it's outright prohibiting spread pricing or something that might be a little more watered down. Also, in the PBM space, we all know about rebates, and there's concern about rebates and not understanding what's the extent of the rebate, and is the PBM pocketing the money? Is it flowing through to the plan of the participants? Well, there are proposals that are being considered that very well could end up in lame duck in this large package that actually requires the PBM to fully pass through any rebates, once again, increasing transparency going along that theme. So that's the type of stuff that we could very well see by the end of this year, even before the new Congress and the new administration starts.
Well, you just took about 4 of my questions, Wayne. That's okay. I'm teasing you, but we'll come back to some of that. Let's move on to, and I know you just talked about some of them. Let's talk about the hot topics right now within the self-insured industry. Can you give us an overview? Some of them you've already mentioned of those hot topics right now. What's going on in Washington?
Yeah, I'd say what's going on in Washington, but it's also what's happening outside of Washington that is driving Washington to pay attention to certain hot topics. And what are those hot topics outside of the Beltway that are driving? I would say first and foremost is fiduciary issues and fiduciary liability for plan sponsors as well as service providers. And what's driving this increased attention on fiduciary issues, fiduciary liability for, again, plan sponsors as well as service providers is some lawsuits that we have seen filed. Either lawsuits from employee participants against plan sponsors claiming fiduciary breach for certain decisions that were made or certain inactions on the part of the plan sponsor. We're also seeing lawsuits from folks like the Department of Labor against service providers, where the Department of Labor has filed a lawsuit against an insurance carrier-owned TPA suggesting that or alleging that that insurance carrier-owned TPA was utilizing plan assets to pay for a tax for medical providers that were operating within the insurance carrier-owned TPA's network. And the main theme there is the Department of Labor is focusing on fiduciary liability, fiduciary status, and that is driving a lot of the attention in and around fiduciary. And there are other items that I'm sure that you'll also ask. I don't want to step on your questions, but at least that's what we're seeing right now. And we can dig in to those lawsuits, whatever you'd like.
Okay, I appreciate that. Let's start with fiduciary issues because you just spent some time talking about it anyway. And it's interesting because my benefits attorney and myself just did a 2-hour webinar for our clients on fiduciary issues just last month. And so you're right, there is a lot going on right now. Those court cases are quite interesting. And, that's something that I do want to dive into just a little bit. So what specifically are the most important fiduciary issues that our audience should be aware of?
My response would be a reasoned process. And what do I mean by a reasoned process? Well, the plan sponsor needs to take it upon themselves to understand how their plan is being operated, how their claims utilization is spiking or not spiking, population management, even what type of benefits should be covered are not covered. Those are the type of kind of decision points or things that plan sponsors need to worry about when it comes to adhering to their fiduciary duty of acting in the best interest of plan participants, keeping plan costs low. And what I mean by reasoned process is the plan sponsor has to engage in a decision-making exercise. When it comes to benefits, like what do I cover, what do I not cover? You got to think about it. You really have to talk with your consultants or you can do it internally, but you need to have a reasoned process for making a decision in that regard. One issue that we discussed that plan sponsors are wanting claims data. Another issue we'll talk about later that they're not necessarily getting, but the plan sponsor needs that data. They need to review that data and or hire a data analytic firm or otherwise to then go through a reasoned process of, are my claims being paid correctly by my service provider? Are there overpayments? Are there mistaken payments? How is my claim utilization? Do I need to look into incorporating a cost containment program? And it's that thought process that you must go through. And I would say that's the biggest thing. The other one is monitoring your service providers, making sure that your service providers are doing what you, the plan sponsor, hired them to do. Right. And if we do talk about the lawsuits a little bit later, there are just our examples, either through recent lawsuits or otherwise, that we hear that plan sponsors are not asleep at the switch, but just oblivious, either because they are negligent or just because they're doing other things. It is kind of part negligence. But needless to say, the plan sponsor is not taking the necessary step to know what's going on. Are they overpaying for a benefit? Are they being charged excessive fees? It's those items, those issues, those priorities that plan sponsors need to take upon themselves and monitor their service provider, because otherwise you're opening yourself up to liability.
Yeah, and I'm glad you talked about that because, as I said, we recently covered this in quite a bit of detail in a webinar that we did for our clients. And I don't think people really understand how important that stuff is. And monitoring is the most important. It's where most employers, I think, most plan sponsors, I think they have the best intentions, but I think that's where they fall apart a little bit is the monitoring. They get everything set up, and then they kind of go on to other projects, and they kind of forget that they need to go back and continue to do that. So that's something that we hit on quite a bit. And I actually want to come right back to what you were just talking about. Let's talk about those employee and plan participant lawsuits, because I think that's a big part of what you were just talking about. There are a lot of different ones going on out there which affect health plans, including access to claims data, Department of Labor lawsuits, and those filed by employee participants. And those participants are actually filing suits against their employers, the plan sponsors. So let's get into this. Can you fill our audience in on these lawsuits and what this all means to the industry?
Yeah, and let me just start with the employee participant lawsuits, because I do want to talk about the Department of Labor lawsuit that we touched on, but also the lawsuits to try to get health claims data, which is something that I did mention. So, and again, I also want to kind of provide the nexus and pull Anthony in on how those lawsuits, once again, are impacting policymakers in Washington, D.C. But back to your question on employee participants. So in the retirement space, over the last 2 decades, participants were filing lawsuits against their service provider saying, you're making bad decisions regarding investments. You are overcharging us as the plan and the participants when it comes to fees. And many ERISA practitioners like myself thought that over time we would see those similar employee lawsuits in the healthcare space. We didn't see that for, again, about 2 decades until February of this past year. We saw the first lawsuit. Johnson & Johnson, an employee participant, filed a lawsuit against the plan sponsor and the fiduciaries in their individual capacity, alleging that J&J was overpaying for prescription drugs, and also other matters like failing to monitor, failing to ensure that the PBM, in this particular case, I won't name names, was steering participants to PBM-owned pharmacies that was charging a higher price than a participant could otherwise get if they went to a non-PBM-owned pharmacy. So this goes back to the plan sponsor, one, making reasoned decisions about the cost of the benefits that are being covered, but again, back to the monitoring, right? And I don't want to kind of mangle or make this a bit more murky, but the PBM practices that we saw in the J&J lawsuit is also driving some of the policy that we might see in Washington, D.C., and I'll touch on that. So I just want to kind of maybe keep our viewers and listeners on the edge of their seat on that one. But that's really the employee participant type lawsuits, really plan sponsor oriented, not making the right decisions that relates to benefits, overpaying benefits, and failing to properly monitor. But there also was bad behavior by service providers, which we'll get to. And maybe that segues into the Department of Labor lawsuit, which I touched on. The service provider here utilizing plan assets to pay a provider tax that was never disclosed to participants. Again, an example of not necessarily employee participants, here it's the Department of Labor, but a service provider behaving badly. And then maybe this segues into what I didn't talk about was lawsuits, plan sponsors here. So plan sponsors, not the employee participant, plan sponsors filing a lawsuit against their service provider, here the owner of the provider network, which is primarily an insurance carrier on TPA, alleging that that insurance carrier on TPA is refusing to share health claims data with the plan sponsor. And the main argument here from the plan sponsor, and this goes back to fiduciary issues and liability and why it's such a hot topic. The plan sponsor is saying, if I don't have my data, and going back to my reason process, I can't do my job. I can't meet my fiduciary duty as a plan sponsor because I don't have the necessary information to monitor my service provider, determine whether they're doing the right things. And maybe I'll end by saying this and flip it over to Anthony. the fact that plan sponsors need the data to meet their fiduciary duties is resonating with Congress, where Congress and even a Harris-Walz administration, I would envision, would understand and potentially move on some sort of regulation and some sort of improvements to the law to help plan sponsors get that data, because policymakers understand the need for plan sponsors to be able to do their job, and they can't if they don't have the data. So that's a one example, at least, and then I'll turn it over to Anthony because I know I keep talking. But one example where fiduciary issues, hot topic in self-insured, is not only impacting, obviously, the industry, both plan sponsor and service provider, but is driving policy in Washington, D.C. What say you, Anthony?
And Chris, just going back to the data, correct me if I'm wrong, but isn't the issue not only just getting the data, but having usable data, right? Because our plan sponsors have availability of some data and it's just not usable or not proper data, or it's just a crazy amount that no one could ever really put into use?
Yeah, and that's an excellent point. And it maybe goes back to our conversation about what we could see from a new Congress or a new administration when it comes to improving the price transparency rules, because currently the information's out there and data scientists and many consultants are going out and they're grabbing the data, but much of that data is not usable and certainly not consumable.
Machine readable files.
Sorry. Yes. So exactly. And then back to Anthony, and I'll turn it back to you to finish your thought. So yes, 100%. It's if we, the plan sponsor, don't have usable and consumable data, we once again can't do our job. So therefore, Congress, administration, you must do something. So go back to you on what you're hearing there.
Yeah, just like to finish up on what Chris said, it's definitely a hot topic in DC, and it's something that the more these cases come out, the more pressure is kind of mounting to get something passed.
Well, let me come back to, you mentioned the J&J case. What about the Wells Fargo lawsuit?
Yeah, and I didn't want to spend too much time on just the employer participant, but I'll actually briefly talk about the Mayo Clinic lawsuit then as well. So there's 3 employer participant lawsuits that are like prevailing, that everybody, I want to say not most people, everybody's talking about. The J&J lawsuit, as I said, employer participant filing against the plan sponsor saying you overpaid for prescription drugs and you failed to monitor. The Wells Fargo case is almost identical to the Johnson & Johnson case. So in that instance, there's not much of a distinguishing fact to kind of point to between the Wells Fargo case relative to the J&J case. They're largely similar allegations, again, back on PBM, overcharging prescription drugs, the plan sponsor willing to overpay, as well as the plan sponsor's inability to monitor the bad behavior by the PBM. The Mayo Clinic, however, is a little more interesting. It doesn't involve prescription drugs. It actually involves medical claims, and in this case, out-of-network claims. The main issue here is that Mayo Clinic did not properly follow what was in their plan document and SPD, and really the terms of their plan as it relates to reimbursing out-of-network claims that are not otherwise protected by the surprise billing protections. So set emergency and out-of-network at an in-network facility aside, that's different than these issues. These are elective out-of-network medical items and service that were furnished that the plan had initially said we would reimburse at a particular reimbursement rate, to which the plan did not reimburse at said rate, and that left a balance bill for that participant. And the participant came back and said, one, that's not the prudent way to operate your plan. Also, back to kind of reason process, make sure you know how your plan is working and making sure that your documents, writing down your documents, having that conversation between you and your consultants and even any providers in your network, not to say the providers directly, but the owner of that provider network, to ensure that stuff like this doesn't happen. And also the plan sponsor just needing to communicate the right information to the plan participant. We could very well see similar lawsuits like the Mayo Clinic. It might not necessarily be in the out-of-network context, but it could very well be somewhat similar to a J&J and Wells Fargo, just saying you're overpaying for a particular medical item or service, or you're underpaying for a particular mental health or substance use disorder benefit. So a lot of the plan sponsor community and service provider community are, to an extent, bracing for potential lawsuits over the next 3 to 5 years in this area.
Yeah, that's a lot of information. Those are great court cases, though, and people need to understand what it really is coming down to. I just want to kind of summarize this. What's really coming down to is plan sponsors adhering to their fiduciary duties. I mean, that's the prudent person standard that's built right into ERISA. Am I wrong with that? I mean, that's what it really comes down to, correct?
100%. 100%. And then to kind of put it into context, because I recently wrote an issue brief relating to ERISA fiduciary duties, a lot of people, it's hard to conceptualize when you hear, oh, you have a duty to act, in the exclusive benefit of plan participants. That's the statutory duty under ERISA. But what does that really mean? And again, it goes back to reason process. What it really means is making sure that you're making decisions that are in the best interest of your participants. And there's a number of ways to do that. So again, going back to like benefits, you try to figure out what benefits to cover, what benefits not to cover. What's the cost associated with the benefit that you're covering relative to a benefit that you're not covering? Your duty is to keep plan costs low, which is part of also the duty to act in the best interest of participants. So there's some tangible things that I could try to put into context for people and listeners and viewers to understand that this duty, what does it really translate into? And that is trying to, make the right decisions, not overpay. Again, back to monitoring. I mean, I'm jumbling some things, but I think folks get the idea, and I hope they're getting the idea of just some of the real world, tangible ways in which a plan sponsor could be found not adhering to their fiduciary duty.
And simple things like, it's not always in the best interest of the plan participants to hire your golf buddy, as your vendor, whether it's a consultant or wherever it is. I mean, just simple things like that, right? So,
yeah.
I know, again, you've already kind of talked about this, but I want to kind of drive it back home here. We talked about monitoring service providers. Is there anything, I know we talk about that all the time. As I said, we just did another 2-hour webinar on it just recently, but is there anything that our listeners and our viewers now need to know specifically about the requirements of monitoring service providers that you haven't already said?
No, because I don't want to be too repetitive, but it just, you got to make sure, well, let me say it this way then, to your question. Read your contracts. Be active in, asking questions relating to your contract. Yeah, you're allowed to rely on your broker. Yeah, you're allowed to rely on your consultant to help you with those contracts in those negotiations. But you can't just rely on them, writ large without asking questions or without having some sort of reasoned process in your interaction between that consultant broker that's ultimately resulting in the contract between you, the plan sponsor, and whatever that service provider is, be it a PBM or an insurance carrier and TPA renting the provider network to the plan. You do need to be a part of that. And then ongoing, you've got to make sure that they're not steering, in the context of PBMs, as I mentioned in the J&J case, that they're not steering participants to, higher costing vendors or providers. And that could even work on the med-surg side, obviously, the medical benefits side of the ledger. So you've got to make sure that your plan is not paying, unexpectedly, unnecessarily, either excessive or hidden. And that's the duty of monitoring. Let me also pivot to this, fiduciary issues, what it means in real life terms, and also then what's driving policymakers when it comes to fiduciary issues. I gave you the example of the PBM practices that we saw in the J&J case. And many would argue, I would argue, that that's bad behavior. Steerage, as I mentioned, overcharging, entering into a contract with the plan sponsor when you know you're overcharging. If a PBM was a fiduciary and subject to the same fiduciary duties a plan sponsor is subject to and required to act in the best interest of participants, to give you a real world example of if that were to happen, because right now that's not the case, but if it were to happen, and the PBM steered, they would be liable for self-dealing, which is another aspect of fiduciary issues and fiduciary duties. It wouldn't be prudent for the PBM to enter into a contract with the plan sponsor when that PBM knows that they're overcharging for benefits. That would be, that would trigger ERISA liability should a PBM be a fiduciary. So again, there's some tangible examples of, I hope, tangible examples that people are understanding that really drives home what fiduciary duties are and issues and what actions and inactions could result in liability. And then the last thing I'll say, and I'll flip it back to Anthony to talk about PBM reforms briefly, is there is interest in Washington, D.C. about potentially amending ERISA to deem PBMs a fiduciary. And if they were deemed a fiduciary, which they currently are not, under the statute, then those practices that we've mentioned and that a lot of other people could put their finger on, they would arguably be eliminated, if not mitigated, if Congress were to act in that regard. And so, Anthony, what are you hearing in that regard?
Yeah, I could definitely see that getting done in the next term. I think there's a massive push to make them responsible. And that goes beyond just some of the transparency things that we've seen, but to generally make them a fiduciary. Yeah, I think it's certainly something that has a very good chance of passing in the next term.
Well, thank you for that. I want to ask about health claims access and audit rights, because I know that's another hot topic. What do you have to say about that? Chris, I know you have things to say about that. I was just in your session.
Yeah, sorry I'm talking so much, but this does then give me an opportunity to talk about the lawsuit, which I didn't talk about, but there were two union plan sponsors and one single employer plan sponsor have respectively filed lawsuits against the owner of the provider network, in this case, an insurance carrier and TPA, saying you must share the data with me. And again, as I did allude to, the plan sponsors here are arguing I need that data to do my job, to adhere to my fiduciary duties. And those court cases continue to make their way through the courts. But what's interesting about these particular lawsuits that I didn't mention is there is a provision of the law that came in at the end of 2020 through CAA 2021, the Consolidated Appropriation Act, that I affectionately call the gag clause prohibition. I think a lot of people call it that. So I'm going to call it the gag clause prohibition. And the law currently says that owners of provider network, are required to share this data with the plan sponsor, and that the plan sponsor must attest that there are no restrictive gag clauses in their contracts that prohibits the sharing of that data. Well, many of us were very excited about the enactment of that provision in the law. However, over now 3 years, the owners of the provider network are still not sharing the data. And I'm sure that you've had podcasts and you've either heard me talk about it previously as well as other talk about it, that this attestation requirement, plan sponsors, some are making, but some aren't, because they're concerned that they don't know, or they do know that there's gag clauses in their contracts, and therefore they can't properly attest to the government because they might expose themselves to fiduciary liability or otherwise. And these lawsuits are actually pointing to this provision of the law as a legal sword or arrow, if you will, to say, hey, Congress told these owners of the provider network they got to share the data with me. Court, what say you? Court has yet to rule, so we'll see what the court does or courts do as it relates to putting teeth behind this provision. And we're all anxiously awaiting that. But then that all kind of segues into, again, back to what Congress might or will do. And Congress is very well aware of the owners of the provider network not sharing the data. You heard me already talk about they're very well aware of fiduciary duties. This J&J lawsuit, honestly, it really is turning up the volume on fiduciary issues, making it that much more of a hotter topic, again, within the self-insurance industry, but also within Washington, D.C. So, just a short shrift, but to be repetitive yet again, we could very well see the next administration as well as the next Congress try to put more teeth behind the gag clause prohibition and You asked about audit rights. So sorry, I'm droning on, but about audit rights. And this goes back to, you asked about what do plan sponsors need to do. You got to read your contracts, because those contracts have the restrictions in there for your ability to audit your claims adjudicator, to audit a full health claims data set, to have routine audits. Those are provisions in these contracts that aren't in your favor. So you got to read your contract. You've got to, I'm not going to say hire someone like me as the ERISA attorney, but hire your ERISA attorney and or someone who knows contract law. Have them read those contracts and understand where the line items are, and go back to your service provider and say, no, the law doesn't allow this. And even if you want to fight with me over the gag clause prohibition, what the law allows or doesn't allow, you're not allowing me to adhere to my fiduciary duty. So that's why you got to do this. Those are the arguments that you should advance related to monitoring, related to audit rights, and many of the issues that plan sponsors are wrestling with.
All right, well, I want to come back to something that you've already talked about, but I kind of want to, again, summarize it here. What about the fees that are paid to health plan service providers? Obviously, the CAA had a lot of disclosure requirements in them. And briefly, I just, if you could talk about the 408B2 disclosure requirements. A lot of people think they don't have to comply. Can you just comment on that?
Yeah, Anthony, why don't you start on 408B2 and then you can hand it over to me.
Yeah, I believe Congress sent a letter to the DOL. I believe it came out of Ed and Workforce Committee, kind of going over some parts of it. So in the 408B2, plan sponsors must obtain disclosures from their brokers and benefit consultants prior to the execution or renewal of the service agreement with the broker or consultant, and disclosing the amount of fees if any entity other than the plan sponsor opted to contract with provider services. Chris, you have anything to add to that?
Yeah, and so Anthony alluded to a letter, but I'll even take a step back to say, this 408B2B, so 408B2 Cat B disclosure applies to health plans. But this 408B2 disclosure was previously applicable to retirement plans and now extended over to the health plan world. And as Anthony mentioned, this disclosure requirement requires, at least the statute says, brokers and consultants to disclose the fees that the plan is paying for the services that they're providing, as well as any indirect compensation, really almost any kickbacks that broker consultant might be getting for the services that they're providing to the plan, that the plan might be hiring, that external third party that then was recommended by the broker that might not be disclosed and is getting a kickback in that regard. So that's the type of fee disclosure that Congress is trying to get from brokers and consultants. But what's interesting is, even though the statute says brokers and consultants, 408B2B is not limited to brokers and consultants. And that's because the statute provides a list of services that you don't have to be a broker or a consultant to provide those services. And the law says if you provide those services, you are subject to this disclosure requirement. So Dorothy, to your question, you asked, who's complying or who's, furnishing these 408B2 disclosures and who's refusing to do so. Well, we are finding in the industry that TPAs and PBMs are refusing to provide or furnish a 408B2 disclosing the fees they're getting from the plan, as well as any indirect compensation should they be getting any. And the position they're taking is the statute says broker, the statute says consultant. We're not a broker, we're not a consultant.
Right.
Back to Anthony's letter, the chair and ranking member of the Education Workforce Committee wrote a letter to the Department of Labor and said, Congress always intended for this to apply to TPAs and PBMs, provided they performed these particular services. And that letter asked the Department of Labor to issue clarifying guidance. Unfortunately, the Department of Labor has yet to issue any clarifying guidance. So I could very well see, Anthony and I could very well see this type of clarification show up in a lame duck end of year bill, along with much of the transparency provisions. And or if it's not in an end of year bill, some sort of clarification in the next term of Congress that reflects Congress's intent, once again, was reflected in that congressional letter, and again, is all geared toward pushing back on those service providers who are simply saying, nope, doesn't apply to me. Congress is saying, yep, it does.
Well, let's talk about the important issues in the House right now, which I believe are transparency, data sharing, and PBM reforms, which, again, you've talked about some of these briefly. Can you fill us in on these particular issues in the House?
Yeah, Anthony, why don't you start on that, and then I'll back clean up.
Yeah. So like I talked about in the House, a lot of this was included in the Lower Cost, More Transparency Act. Was passed last year, extremely bipartisan. I believe over 300 votes, right, Chris?
Yep.
Yeah. And so within that, it kind of was an all-encompassing bill with a lot of the highest agenda items. You had transparency. It would codify the transparency and coverage rules. It would have a requirement to publicly disclose prescription drug prices on a machine-readable file. Some data sharing requirements, gag clause prohibition a provision that Chris was getting into, and then there'd be a lot of PBM reforms similar to the PBM reforms we'd see in the Senate. That bill had a disclosure of RX drugs prices, rebates, discounts, and I believe it was included in the House bill, but the Senate had a ban of spread pricing in that proposal.
Yeah, what's interesting is, as Anthony indicated, we alluded to earlier, the House passed the Lower Cost, More Transparency Act, it's called, that included these transparency and data sharing provisions with 320 votes. And that just goes back to what I said previously at the beginning of our conversation here about there could be some bipartisan, agreement on certain policy items. And in this case, we see bipartisan agreement on transparency and data sharing, and we could very well see that in the next Congress. But what's in this House passed bill that Anthony alluded to is, again, codifying the hospital transparency pricing requirements, the payer transparency requirements. And actually something I didn't mention earlier, but Anthony did mention it, is also disclosing on a public website through a machine readable file prescription drug prices, which is something that was included in the suite of regulations during the first Trump administration, but was put on hold. The House passed bill would codify the hospital transparency pricing requirements, the payer transparency requirements, but also something that I did mention is it would codify a requirement that payers would have to disclose through a public website on a machine readable file prescription drug prices. Now, this requirement for disclosing prescription drug prices on machine readable files was in the suite of regulations that was issued back in the first Trump administration, but was never implemented due to a lawsuit and due to other issues relating to implementation matters.
Well, I understand that in late March, the federal departments finalized some regulations that were proposed back then, that were issued back in July of 2023, which focused primarily on short-term health and fixed indemnity plans, but also included a request for information in them on level-funded arrangements. Can you fill us in on that particular issue?
Yeah, I mean, I don't want to minimize the issue because it's a big issue, but there's not a lot that's come of it yet. And what I mean by that is this. So to your point, there were regulations that were primarily geared towards short-term health plans and limiting other indemnity type of plans in the Affordable Care Act markets. But tucked in that regulation was a number of questions, which we refer more to as a request for information. These questions were requesting information on level-funded health plans. And SIIA issued comments and responded to some of those questions, as did other insurance regulators who are on the other side of the issue. But nothing has come out of that request for information. And what I mean by that is we saw a finalization of the short-term health plan regulations as well as the regulations on indemnity plans. But in that same final reg, it simply said, hey, everybody, thank you for your comments, but we're not about to issue any guidance at the moment. But this is a good segue maybe back to the original question that we started with, is what could we see from an administration? If we were to have a Harris-Walz administration, we could very well see that administration picking up those comments and making them actionable and putting them into a proposed regulation in some way, shape, or form, which might regulate stop-loss insurance, either from an attachment point perspective, from an employee life perspective, almost mirroring what we're seeing at the state level in some states that have chosen to regulate stop-loss, all in an effort to what detractors of level-funded plans would say is eroding the Affordable Care Act's market. And why would a Harris-Walz administration care about that? Harris-Walz administration, Biden administration, Obama administration, more Democratic-leaning administrations, of course, protectors of the Affordable Care Act, wanting to promote the Affordable Care Act, and therefore are adverse to policies and products out there that would otherwise diminish and or erode in their eyes the Affordable Care Act and its effectiveness. So we could see something, but right now we're not seeing anything.
Yeah, well, we're running out of time, but I do want to get to a couple of very important questions. The first one is the cost of prescription drugs, particularly specialty drugs. Obviously, that's been a huge issue for plan sponsors. What's happening right now in Washington related to the cost of prescription drugs?
Well, both parties want to lower prescription drugs costs, but it's not that easy. And there's a lot of conflicting ideas on how best to do so. I think from a potential Harris-Walz administration or a Democratic administration, I think we're going to see expansion of Medicare negotiated drug prices and possibly expanding that to the private sector.
Okay, great. Let's move on. Again, one last thing that I want to ask you about that I think is a really hot topic in Washington for what I'm seeing, and that is the use of artificial intelligence. I know it's changing every minute of every day, obviously. Technology continues to explode and things are changing all the time. But what are they doing in Washington related to AI?
So this past spring, the Senate just released this huge, comprehensive, bipartisan AI roadmap, and it was commissioned by Speaker Schumer along with Republican leadership as well. The goal was to make it as all-encompassing as bipartisan as it could be and serve as a roadmap to guide future legislation on AI. And it contains everything from specific healthcare applications to how they would fund certain departments in regulating AI, set best practices, guidelines, and standards for the use of AI and applications to government. So we expected that to be a top priority, which I think it remains in the Senate. But since then, we've seen certain House leadership, especially on the Republican side. I believe Steve Scalise, who's a very prominent, he's in the Republican leadership in the House, came out right before August recess and said that bill would be, any AI bill out of the Senate would be dead on arrival in the House. So again, this kind of goes back to what all the policies we've been talking about. It really comes down to the politics and what's going to happen in the election and what we're going to see in the lame duck session. So it remains a top agenda item in the Senate. We'll see how it shakes up in the House in the next term.
Well, thank you very much for all this valuable information and for all your insights. If anyone should want to reach out to you guys or the Self-Insurance Institute of America, how would they best do that?
Well, you can email us. So Chris Condeluci at SIIA.org.
A. Murrello at SIIA.org.
Great. And what I'm going to do is I'm going to put in the show notes a link for their email addresses, and so you'll have a proper spelling and so forth so that you know how to reach them if you need to. Thanks, you guys, so much for being with me today. I really, really, really appreciate you.
Yes, no, Dorothy, thanks so much for having us. Great conversation, as always, as expected. And if you or anybody else needs anything from us, you know where to find us.
Thank you so much, Chris. Really appreciate it. For all of our audience members, please stay safe, stay healthy, and stay tuned for the next episode of the Benefits Executive Roundtable. Thanks, everyone.
Thanks for watching. Stay tuned for compliance tips, cost containment ideas, new trends, and decision-making tools. This podcast is produced by Advanced Benefit Consulting, Anaheim, California. All views expressed are those of the host or interviewees and not necessarily the views of Advanced Benefit Consulting. Information contained herein should not be construed as legal advice. We always recommend that you consult with your legal counsel as situations do vary. Ms. Cociu can be reached at 714-693-9754 extension 3 or toll free at 866-658-3835. by email at dmcociu@advancedbenefitconsulting.com or visit our website at advancedbenefitconsulting.com.